Well, the symptoms of ovarian cancer are often very difficult to pick up on, and as a result, ovarian cancer is often called the silent killer because patients don't tend to have any symptoms until a very late stage. If people do get symptoms, the most common ones are abdominal distension and people's abdomen swelling up. Yeah, ovarian cancer generally does go unnoticed until it's in the later stages, unfortunately, because there just aren't many symptoms with the early stages. So around 70 to 80% of the people we see are diagnosed at late stages, and the people who are diagnosed at early stages are usually diagnosed by accident when they're being investigated for other things. It is possible to catch ovarian cancer early, but the difficulty with detecting ovarian cancer at an early stage is because the symptoms are so non-specific. It's hard to tell people what to look out for with any certainty. And also because things such as screening, which have been undertaken for lots of other cancers to try and pick them up at early stages, has not yet been shown to reliably detect ovarian cancer at an early stage. So there aren't reliable tests that we can tell people to get as a routine like we would do, for example, with breast screening in order to pick this up at an early stage. So for most people, ovarian cancer will be treated with a combination of surgery and chemotherapy. It's one of the cancers where chemotherapy can make a massive difference in terms of both people's symptoms and their outcome. And increasingly, we're also looking to what we call maintenance treatments, which are usually tablets that we start people on after they've completed the chemotherapy and surgery to keep the cancer from coming back. And again, that's making a massive difference to people's outcomes. It can be possible to live a full life. I think the difficulty is because ovarian cancer is almost always picked up at a late stage. There are people that unfortunately we can't cure from ovarian cancer, but because the treatments are getting better and better, we can keep people going often for many years with ovarian cancer. If it's picked up at an early stage, it is most definitely curable. And we have a lot of people who have been able to be picked up at an early stage for a whole host of reasons, particularly if there's an underlying inherited component where we can safely discharge them after 10 years with the knowledge that they will live an ongoing cancer-free life.